Hi, first of all, congratulations on your pregnancy. Today in this video, I'm going to share with you my experience about my maternal fetal medicine consultation. I will walk you through what is MFM and why I was suggested to go for a MFM consultation, and what are the things that I have experienced during this consultation period, and when did it end and how is my experience. So hi, welcome back to my channel, and I am Shubha. If you are new here, please subscribe to my channel so that you get all the latest video notification whenever I post a video. So today when I'm filming this video, today I'm exactly 27 weeks pregnant. Let me just give you a brief about what is MFM, which I have learned from the internet, and what my doctor has also told me. So actually MFM doctors are specialist doctor. After they have completed their gynecology study, they have studied further for another 4 years about maternal fetal medicine. And then if your OBGYN tell you that you are in a high risk of pregnancy, sometime they refer you to the MFM consultation. So the next question which comes to my mind is why I was referred to an MFM consultant. So what happened is, I have a 8 years old daughter, and after that back 3 years back from now, I had a miscarriage at around 17 weeks. So that was a big concern for us, for the doctor as well, and that's why she suggested that I should be referred to MFM consultation. So normally the MFM consultation starts at 16 weeks and end by 24 week of your pregnancy. So I will just take you through how was my first appointment, what to expect during your other appointments, and what happens there. This is your first appointment is with a consultant, a doctor who will consult with you about what are the things you have gone through in your last pregnancy and why you are here today, what are the challenges in your present pregnancy and all that thing. And he or she will also give you a plan about this pregnancy, how they are thinking that they will take this further along. So during the first consultation, it took me around more than an hour, because there was a lot of paperwork to be done. I don't have to write anything on the paper. It was all with the doctor, and she was just putting all the information in her computer. But she was just asking me every details about my family history, if they had any kind of medical history, what I had gone through in my earlier pregnancies, and if I had any kind of medical issues, and as such, means many details. You have to say everything about your last pregnancies, if you have any medical condition which is not related to pregnancy, if your parents or other family member has gone through any severe major health issues. I'm getting little out of breath, as you can imagine that it's 27 weeks, and yeah, I'm growing, my belly is growing. So whatever, that was the first consultation, and because it was week 14, the doctor suggested me that today we are not going to do any kind of ultrasound, because that will not give us a proper picture what we want to look at. So mostly they told me that they will measure my cervix and see if there is any opening or short cervix kind of a situation. So after that I got an appointment after every 2 weeks. So all these things were not done by my OBGYN or at the clinic. I was sent to the hospital every 2 weeks, and I went through cervical check, like internal cervical check, every 2 weeks. So starting from 16 weeks to 24 weeks, every 2 weeks I was visiting the hospital, and it was clearly mentioned that it was cervical length check, along with sometime it was growth scan as well. So during all these visits, there was an internal scan which was done on me, and they used to check whether the cervix is in a proper shape and proper size or not, if there is any kind of funneling or opening in the cervix. And then the doctor suggested, if we find something like this, we might have to do a procedure on you which is called cerclage, or if it is less or we can treat it with medicine, we will do that. So for that reason they were checking my cervix, because last time when I miscarried at 17 weeks, it was due to opening of my cervix, and the water broke. So that was the situation. So this time they wanted to make sure that everything is okay in these particular issues. So what you can expect during your ultrasounds for MFM consultation, I think the MFM doctor will not see you if not required, but a nurse will be there in the ultrasound room, and an internal ultrasound will be done every 2 weeks, and they will check everything in details. And after that, after checking, they would call the doctor. That could be the normal ultrasound doctor, or if required, if you request that I only want to see the MFM doctor, they will call the MFM consultant, and he or she will tell you that what are the things, if everything is okay or if anything is concerning, they will let you know about everything. So this takes something around 15 to 20 minutes of time, and it's like just a regular ultrasound scan done during the pregnancy. During my 20 weeks, I was suggested that you don't need to take 2 separate appointments for MFM ultrasound and the anomaly scan, which is normally scheduled for every patient at 20 weeks. So I had both of these 2 things done in one time, and it is convenient, and in 20 weeks you get to know the thing which we call anomaly scan or growth scan. They see the baby, if everything is all right, if all their body parts are present and everything. And then I also had my cervix scan, and the doctor at the end said that everything looks fine. After 24 weeks there will be no more MFM ultrasounds performed, because after 24 weeks they do not do circlage, or there is no requirement of going through this process anymore. So if you are referred to MFM consultation, it will start at around 14 to 16 weeks and it will end at 24 weeks. So during your appointments, you are free to ask any question to the nurse and or to the doctor. If you are having any kind of discomfort or any question that you have in your mind, feel free to ask your doctor and inform your nurse that these are the concerns and I'm having. So it is also said that if you are having some risk with your cervix, or you are going for MFM consultation, make sure that every time you go for an ultrasound, you have to inform your technician or the nurse who is performing that procedure that I have this issue, and then they will they will take care of that while performing any kind of test on you. So with this we come to an end of this video, and I think that my personal experience about the MFM consultation was helpful for you. If it has helped you in any ways, then I'm so happy and glad about it. And if you have any question or suggestion, let me know in the comments below. I would also love to hear about your story. See you next time in my video. Stay blessed and happy. Bye bye.